Good evening and happy Sabbath to everyone. Yeah, my wife is known to many of you who come from Kuching Church, and she told me, her principal is here, and his wife, Pastor Chu and Mrs. Chu. Okay, so before I talk about the health talk, I guess I should share with you a little bit about myself. So that's my wife now, very different from the time she was in Sunny Hill School, right? Yeah, she used to be from so-called the mountain or the countryside, the hilly side, So she was very lack of self-confidence, she said, yeah. But I'm an overconfident person. Opposite pole like each other. Yeah, I just attracted to her somehow, So she also did up her teeth. When I first met her, her teeth was this way. Okay, they say it could shuffle snow, but there's no snow in Malaysia. Yeah, or they say it's a pineapple grater. Penny, whatever it is, So I was making fun of her. She was very cross with me, actually. I don't know. You want to like a girl, you should talk nice about her. But I don't know why she liked me after that. I was making fun of her when she started using the braces. I wasn't making fun of her because of her teeth going forward. Yeah, I think Pastor Chu, you will remember. She was a very shy and quiet girl. She was already working in Penang Adventist Hospital when I came back from overseas after my study, before I joined the government for my housemanship and all this. Yeah, this is just last month, right? This was just last month, during the time we have Penang Adventist Hospital staff annual dinner. This is my father-in-law. This is 10 years ago. I visited Jasper, Alberta, Canada. Yeah, so my father-in-law lives in Alberta with the son, my brother-in-law, Steve Shim. Yeah, so I visited them. I'm not that an avid traveler, I guess getting old. I get old, so I'm not very keen to travel. Partly, my wife can't really travel, because of some health restrictions, so it's very troublesome for her to travel. So it makes me not very keen to travel. Usually people, when you accomplish, you want to go everywhere, right? But not me. As I grow older, I don't know, I become more sticky to her. Maybe because she spoiled me. Yeah, she made my life very easy, I think Pastor Chu, everything at home I do not do, including changing light bulb. I don't do changing light bulb. Yeah, I don't do. So when she asked me to help, I had to think how to do it. Yeah, because her father is a handyman, right? He can do everything, so she knows everything. I don't know anything. As far as home is concerned, I'm not domesticated. Yeah, I'm not domesticated. And just in case many of you would ask, in your mind, I think Lydia knows, and I think the rest maybe Pastor Sim will know. So, we actually had a daughter before. Yeah, I guess if she grew up, maybe she was thinking of becoming a doctor or a nurse. Yeah, she was very cute. And this is not our daughter. This is a neighbor's daughter. This girl is already maybe about 23, 24. So if my daughter is still alive, it's about Grace's age. Is this the same age? Should be, 97? Yeah, 97, same age with Grace, okay, if she's alive now. Right, but God kept her, make me have less burden. All right, so this is from the balcony or from my bedroom. This is how it looks. So I'm not envious of Melbourne's beaches, okay? You can see I have pretty good beaches. Every morning I can see them. Every morning, okay? We won't have thunderstorm throughout the day. So this is sunrise. This is sunrise. So evening I can have a semicircle. I couldn't find that picture. I can have a semicircle rainbow. Yeah, we can see it maybe once in 2-3 years, I guess. Yeah, in real life, but we have taken a photo. Sharon is an artistic person. So she can take. I can't. My mouth is only very good. I can talk only. My hand is no good. Correct. I'm very good, but talk only. NATO, they say. NATO, okay? Talk only, but no action. Right? But I do take care of myself. I can't take care of you well, no? So that's why I'm a failure in taking care of my wife and my daughter. I don't know how to do it, but I'm a very disciplined person as far as my own health is concerned, right? So this is my Friday afternoon hiking group in Penang. Penang, from the hospital that I work to the place I start to hike, if I drive, 5 minutes usually I'll reach, okay? 5 minutes I can reach. If I walk, 15 minutes. I'm amazed that Lydia, well, she lived there 2 years, she didn't know there's such a place, such a wonderful place. But it's not as nice as the Dandenong Botanic Garden. That place is more beautiful, okay, more flowers. But when we get in the jungle, we don't really look at flowers. We just hike and chit-chat. For those of you who have attended my talk, I've already mentioned I like people more than places, and maybe even more than things. I talk. I chat with people. So we will chat. Well, these are all my patients. Actually, all of them are my patients. They are not. None of them are church member. Okay. I told him, I said, you're probably my best non-SDA friend. Okay. I hope you will be with me in heaven. Well, I wish he appreciated. I told him, yeah, there's the, he is half of the mind, believing the one God faith, right? It seems that Islam is simpler, or most religion it's normal for them to think that they must do something, right? Yeah. Practically every religion. I mean, even in university, or whatever, in your job, if you work hard, you'll get promoted, right? So in the whole world system, it's like that. Where got such a thing that you just say yes and you are in? So a lot of these people have this mental block. So, but anyway, he has been hiking with me. By next year, May, 20 years. I'm not very successful evangelist. Yeah, not very successful. Yeah, he has a daughter in Melbourne who owns some pharmacy. Okay, in case you all need to buy medicine, you can tell me. I'll direct you there so that you evangelize the daughter or the son-in-law or the grandchildren. But I don't know where they live though. Yeah. Okay, so these two others. Right, so this is my walk group. Of course, it's not very consistent. The organizer is this person. Yeah, and I do drag some other doctors to be with me. And none of them are church members, okay? I do the walk on Sabbath. I consider it part of the Sabbath activity. Yeah. Last and not least, this is my Diabetes Association activity. This guy is a Malay guy. I'm going to recruit him to be my volunteer committee next year, and he's willing. Okay, so that's good. So this was just also recent, last month, health screening in the shopping mall. Yeah. I like activity. I like to meet people. I'm not very good at converting people, but I do give Bible study, and generally, my Bible students are all in Mandarin because in the English church, there are enough people to give Bible study in English. So even though I'm in English church, because my wife's an English ad, and she's a shy person, she doesn't, even though she can speak Iban pretty well, but she doesn't think she knows Iban, so she doesn't think she knows Mandarin. So I have to attend in English church. Yeah. But my Bible students usually get baptized in the Chinese church. Yeah, because I give Bible study in Mandarin. Right, choose the best. Habit will soon make it pleasant for you. Yeah, I guess I will be aiming at change, how to change. Today the topic is supposed to be cancer prevention, right? But among you have enough of a health expert to share. You don't need me to tell you. In fact, I was so surprised. Yesterday I asked the question: Is each strike is the home run? Of course, I go. Generally, people will not get the right answer. Most of the time, they get the wrong answer, even though they think that. I was so surprised. Only you give the wrong answer. Okay, because everybody think that the most important thing is to eat more fruits and vegetables. Oh, that is not right. Even though in a way it's right, but in the clinical paper that I read, it's not right. It is really the legumes, nuts, and whole grain. Right? These are the three things that are missed out most. Yeah. Right now, I proceed with question. Let me see. I do have gift, but if you are a medical professional, maybe you should let other people answer. Yeah. I don't mind engineer answer, accountant answer, but I do mind dentist, doctor answer because it's a given. Maybe pastor should answer, all this. Yeah. Which among these is the most important factor for cancer causing? Which one? Huh? I already told you cannot answer. No. Tobacco only 30%, okay? 30% of all. Yeah, so how is correct? It's food, right? It's food. It's not tobacco. So, yeah. Actually, I have a dietitian who said that, why are we digging our grave with a fork and spoon? With our fork and spoon. Why are you digging your grave with your fork and spoon? But I still have to give you, right? No need. Not qualified. Okay, so you can win the gift on behalf of Elder Tim or Pastor Chu? Anyone? Then I will send to Zoom. I don't know, Zoom or do this. Do you still know how to do? I know he doesn't know. Do you know what to do there? So you lost. Okay, I give to him. You don't need to compete. You lost to him. It's a gift for you to remember I came. Oh, this is, turn it off. All right, the next question. Which of the following is not proven scientifically to cause cancer? Yeah, the teacher don't answer. This one I'm not afraid how I answer. Yes? Oh, don't look at my face. My face don't have words. Look at the question. Oh, BRCA cause cancer. Yeah. Gene is a 5% chance of making you to have cancer. Yes. Huh? Salted fish. Salted fish cause nose cancer. Cause nasal pharyngeal carcinoma. Wow. So I got a question that you all don't know. Yes.
Even if it's iron brain.
Yes. Yeah. Yes. That's right. It's C.
I know one, all right.
Yeah, it's a food additive and preservative. A lot of people think that food additive. No. Alcohol, of course, you all know. Alcohol is a very bad thing to have. Alcohol causes breast cancer, okay? Yeah, liver cancer also. Breast cancer, liver cancer, colon cancer, esophageal cancer. About 5 of them, at least, is proven, okay? They just changed I don't know if I put it up there, they just changed a bit of the recommendation. In 2018, actually, they say no bit of Lancet, which is one of the very prominent, prestigious journal, medical journal in the world, or of course in Britain, says that not even a bit of alcohol is good. A bit of alcohol is a bit bad. More alcohol is a lot more dangerous. So no alcohol is good. Okay, but of course I tell my patient that you drink a bit of alcohol, you won't die immediately. But do you want to, I will ask them, how do you want to die? Yeah, it's a good question, isn't it? How do you want to die? Because everybody know 人生是苦随无死. No? Everybody know that someday you will die. Okay? The living know that you will die. The dead don't know anything. So the living will know that you will die. So I just tell my patient, so how do you want to die?
Healthy.
Die healthy. But when you're healthy, you can't die. You know, God's design, if God's design is right, when you're healthy, you can't die. Yeah. But you don't want to die very slowly. Yeah, so actually I asked them, do you want to die fast, or slow? Fast. Most people want to die fast. Okay? Yeah. So which is actually your heart problem, which is what you mean, okay? Actually, you know, when you say you want to die healthy, it means that you still very functioning, you still enjoy life, and then one night when you lie down and sleep, and then you don't wake up the next morning, all right? In the middle of the night, your heart just, and it just stopped, and that's it. But you don't wish your spouse to go like that, right? Because the next morning, hey, she's no more there. You cannot be so selfish, so it's better you die slowly. Oh, don't you think so? You think you want to go fast, lah? Yeah, it's easy because the next thing you open is Jesus in the air, you know. Hey, come up, okay, and go up. But you know how bad it is for your spouse when suddenly, you know, every day you'll still be cooking for you, and suddenly there's nobody to cook for, nobody to disturb. Nobody said, I have a patient whom, I should have put her photo up. Yeah, his photo up. He is such a quiet man. He used to be in my diabetes association. And his wife is a chatterbox like me. His wife is a chatterbox like me. So, and recently, 2 months ago, I took her out for a meal. I told her, it was my birthday, you know, sometimes strange way of celebrating birthday nowadays, you know, as you grow older. Yeah. So I went out with her. I took her out because her husband passed away 2 years ago, I think, 2022. Yeah, 2 years ago. He was such a nice man in the volunteer in the association. So I took her out. So she told me, she says she still misses him. Yeah, even though he said a long goodbye. He didn't die suddenly. He had lymphoma, diabetes complication, going blind. The wife had to drive him and all these things. But still, she misses him, even now, okay, after 2 years. And that's what happened to my cousin's sister. Last night, my cousin came. She still missed her husband. Her husband passed away 2 years ago due to liver cancer. And so they tried so hard. They went to Taiwan, out 3/4 of the liver, and still go. You can't, you know. In this world, someday we need to die. Yeah. All right, the last one. That's for you to answer, Wilson. Yeah. I have a present. See the young men, young ladies know how to answer this. What's the answer? You can guess. There's no punishment for wrong answer. There's present for the right answer. No, I already say the young people only. You all old people don't answer. I won't give you. Okay, young people. Whether Vivian or Wilson, you answer. Really? You got all the wrong answers. Sorry. So who say B just now? Okay lah, never mind. I reward you for the wrong answer.
D technically because there's research done because that's my
Exercise is the one that had already been proven. Yeah, green tea and all these things are very weak. Maybe there are some clinical papers, but they are very weak. Okay, you know why this thing all are more known? Because of marketing. Because it's got money. Okay. So there will be all the research will be very small. I think for those who are in the health profession knows that a lot of this thing now research has been used as a marketing tool. Okay. And it's not new. It's not in the 21st century. It has been there for maybe 40 years. People use it to do marketing. Yeah, even now, clinical research, even hospitals are using so-called research to market their services. My oncology team is better than the other one. You know, so they start collecting some data and say it's a so-called research, right? And publish some clinical paper. And if you go and search, actually there are many journals. Some journal you have to pay them to publish, unlike before. Now you have to pay them to publish, you know. Yeah, that's how it goes. Right, so this is the statistics for Australia. About 50,000 people die of cancer yearly.
Why so many more male?
Yeah. Oh, I answered this. You didn't come to the Chinese lesson. Yeah. You didn't come to the Chinese lesson. I answered in the Chinese lesson. I asked them the question. Ladies live longer or men live longer? What do you guess, brother? Why ladies live longer?
Because they keep talking and then we may die.
No. Because men has more cancer. This one, how has answered this way before. But look at this. While keep listening to neck will not cause you to have more cancer, right? Ear cancer or brain cancer? No. This is talking about cancer death. Cancer death. This is cancer death, okay? So why do men get more cancer than women?
We don't have estrogen.
Huh? You don't have estrogen. Estrogen causes breast cancer, okay? Yeah, estrogen causes breast cancer. So better don't have too much estrogen.
Men are in denial. They don't want to see help.
Yeah, that's a very good answer. That's a very good answer, right? Usually men are more careless about their health. They are not bothered about their health. It's quite unusual, of course, in my audience. Usually I tell them, you just have to count. There are more ladies than men, but this is like 50-50, you know, it's quite equal. So I tell, in most health talk, there are more ladies than men, right? So I just tell them, just very simple, no, the ladies are more interested in health than men, right? The ladies will look at their body longer than men. It's quite unusual for men looking in the mirror, including me. I don't look into the mirror so long. No? Before I come out, I'll be. Do you know my wife is a perfectionist? Yeah. So before I leave, I myself just don't dress it well. I just go in front of her, and then she'll adjust something. Somehow she has to adjust something. So I myself let her adjust. In fact, when we got married first, I don't even choose what I'm going to wear to go to work. She will get it ready. You know, that's her job. Get it ready. You know. This is the tie. This is the shirt. Because a crazy person like me sometimes will get discordant dress, discordant dressing. I will have wrong color and all those things. Yeah. So, you know, that's our problem. Yeah. It's just I am only particular in health. The rest of the thing I'm not particular. Yeah. So physical health-wise, I'm better than her. Yeah. But in general, men are more careless. Men are more risk-taker. And the men smoke more, even though it's changing. There are more ladies. There are more and more ladies smoke or vape now. Is vaping bad in Melbourne? Yeah? Yeah. So somehow, Satan put a lot of traps. Do you need these statistics? Not necessary, right? What do you know? What are the common cancer in society? It's practically pretty similar all over the world. Maybe the difference between Australia and Malaysia would be skin cancer. Pigmented people like the Asian like me, compared to say elder Tim, we go to the sun together. He will get cancer easier than me because I have pigment. So if I get more sun, I'll get darker, but you just get redder like a lobster, like cooked lobster. Yeah, like a cooked lobster, right? So yeah, you will get, if you get enough, you know, the Caucasian that was with me in the hiking, yeah, he got facial skin cancer, right? But generally skin cancer are not dangerous. The basal cell carcinoma are not dangerous. They are very slowly growing, but not melanoma, okay? Melanoma is very aggressive, very difficult to treat. Melanoma is the type that's black and dark, right? Yeah, that kind. But if it has been there for a long time, it's not cancer. Like this, I was born with this to help me to differentiate between right and wrong, right and left, not right and wrong, right and left. Yeah. So yeah, it's been with me since the time I'm born. It has not become cancer yet. It's quite easy to look. I think it's still quite memorable what my mom gave me, right? So I didn't cut it out. I don't think it's risky to become a melanoma. Yeah, but melanoma is very bad to get. Yeah? So here also have quite a lot of melanoma, right? It's quite scary. If you live above 85, about 40% of us will get cancer. You might be interested to know that all of us know that in the Adventist health study, Adventists generally live longer than the general population. I think you all know, right? Generally, it's about 10 years longer. Okay, ladies' advantage less than men. Men has better advantage. Okay, if you are Adventist, you have more advantages because the non-Adventists are more risk taker because we have a so-called restriction of no alcohol, no tobacco, right? These two are really bad. Right? These two already comprise of about the 35% risk of cancer. Okay? They used to think that alcohol prevents heart disease, but it's nonsense. All right? It's nonsense. It's not true. Anyone you are interested, if you want me to speak specifically, because I will be going through to tell you about the general preventive, because cancer is not one disease. Different cancer of different size actually behave very differently, and the risk factor can be very different. Right? So I'll be talking very generally on 10 different steps of preventing cancer. Well, there's something about early detection. Okay, what is cancer? I think everybody knows what is cancer. So what's the good news of cancer? It can be cured. Yeah, I think you probably have seen cancer survivor. It's pretty common now. I know the statistics in US. I think Australia should be very similar. Your medical care is very advanced here. Your system is very good. So you have cancer, generally you are cared for very well. So you probably will have definitely more than 60% cancer survival. Okay? That means 10 people get diagnosed to have cancer, 6 will get cured. Okay? They are going towards 70 now. 70%. That means 10 get diagnosed, 7 get cured. What's the meaning of cured? Cured means that when a person is diagnosed to have cancer, you start treatment. After the completion of all the scientifically appropriate treatment, then the doctor will continue to monitor, right? Monitor. At the point of 5 years after completion of treatment, there is still no traces of cancer in that body. They so-called define it as cured. Okay, in between is just like, well, you don't have we can't detect, but it may still surface. So I think they sort of draw that line of 5 years to say that, without any treatment, you are still cancer-free. It means that that's this enough time period for it to surface, but yet it does not surface, so they are defined as cured, right? But we know that actually cancer cell can surface even after 20 years or 15 years post-treatment. So people should still be vigilant. Right, so what is the warning? I guess it's more complex than this, but these are the general 8 different warning signals, or we call it symptoms. Yeah, so unusual alarm, unusual bleeding, discharge, sore that does not heal. That sore is just kind of like the skin cancer. Yeah. Bowel change of bowel habit is very hard to define. You have to observe. That's the reason why I think generally it's not easy to wait for signal to come. Right? So now people has moved toward early detection even without symptom. like mammogram, you're supposed to do mammogram. Like for ladies, you're supposed to do mammogram. Yeah. But even mammogram, you can't detect 100% of all the cancer, right? But mammogram can detect cancer that is even not yet, you can't feel it. It has not formed into a lump yet. Yeah, there are certain breast cancer can be detected. So this is kind of like very general. For us in this kind of modern age, we need to be more vigilant than just using the warning signals. So you test. I heard that you get to do colonoscopy, which is a lot more superior to fecal occult blood testing in early detection of colon cancer. Colon cancer is one that is very preventable. We don't recommend really Pap smear anymore. We recommend human papilloma virus PCR testing. I think you all understand about PCR testing due to COVID tests, right? You do COVID swab. I guess the nose and the throat is very similar. It's a new technique called PCR, polymerase chain reaction. It's just a way to test. I don't know how it is done, but that same technology is used to test human papilloma virus, right? And they say about 99% of cervical cancer is due to HPV. Okay, that's why there's a campaign to wipe out cervical cancer, right, in the world. It's cervical cancer can be vaccinated, just like smallpox can be wiped out. So cervical cancer can be wiped out if enough people or everyone get vaccinated.
All the children are vaccinated now.
Yeah, both male and female, right?
No, they started with female, but now
They're doing the male, yeah. So that will wipe out the cervical cancer. But cervical cancer is becoming very much a smaller risk, right, compared to years ago. So it is already lower since the availability of Pap smear. So it's become less. Okay, so Pap smear is still recommended for ladies before 30 years old who are sexually active, right? Yeah, because I think it's not effective detection for HPV before 30. PSA, I think, is still useful for men, except that generally PSA, prostate cancer generally is not very aggressive. Yeah, if we live in US, Adventist health study, the US men, Adventist men do not have lower prostate cancer than the general public. I'll straight away tell you the cause. I'm sure you're interested to know, right? Yeah, correct? You're interested to know, right? You don't want to get prostate cancer, even when you're 80, right? Milk, dairy product. Okay? Milk.
Cheese also.
Yes. Dairy product. Okay? Yes. I'm still not sure all the, I like Sanitarium So Good soy milk. But it tastes so much like milk that I'm just thinking whether it also increase the risk.
you think that Adventist men drink more milk than the rest of American?
No, they're equal. They are pretty much the same, no difference.
So why is it higher in
It's not higher. It's not higher. It's equal. No, it's the same. There's no difference. Comparing to non-Adventist, Adventist men has much lower heart attack, much lower colon cancer, much lower lung cancer, but not lower prostate cancer. Same. Adventist women also pretty much having the same breast cancer rate with the non-Adventist women. This is Adventist health study. Why? Dairy product. Okay?
Wouldn't it be true that the Adventist group would have a lower proportion of milk and dairy product in their diet than the...
Oh, you have not gone to the potluck in America. You have potluck tomorrow?
We'll have a lunch.
You have lunch, not potluck. Okay. Yeah. The way, well, too bad I tell you my secret. But I've been to the potluck there. There are more dishes. There are more dessert than the dishes. Right? Those of you who have been there, you know. There are more, the dessert table is a lot more things than the, well, and what are the dessert? Cheesecake and...
The vegetarian diet is supposed to promote sleep. I'm not overweight, but the...
Wow, yeah, Adventists are not that much better.
American diet, Adventist vegetarian diet, they're huge. Because of the dairy product they make.
Yeah. This is one of, I mean, we invited Gary Fraser. You know who is Gary Fraser, right? So Gary Fraser is a chief investigator who has already retired now, the chief investigator of Adventist Health Study 2. We invited him last year to Penang. Yeah. So, of course, you don't need to invite him in person. You can always follow him on the YouTube. You can listen to many of his lectures. You will know. Yeah. Of course, generally scientific people, people who are very good clinical scientists, they will not talk like me. I tell you pointedly, this is the answer. Scientific people, they will tell you it is something like that. That's the difference between engineer and doctor, right? Engineer will tell you, this is the red mark, cannot cross the line. Okay. Right, so, doesn't matter all the tests. Is there a blood test that can check everything? No. None. No such test. Okay? Can you do PET scan to detect all the cancer? No. And it is also not wise to do PET scan to detect cancer because it is high in radiation. And if you do enough radiation thing, I'm not telling people who have cancer not to do PET CT. Because you have to weigh between the pro and cons. Because it helps you to early detect metastasis and then you help you to deal with it. We know now that the oncologists, surgical oncologists, medical oncologists, they are all very aggressive. You have some recurrence or metastasis, if it's possible to cut it out, they'll cut it out, right? It does prolong life. I guess the assumption is that people want to live longer. We have bigger aspiration, right? We not only want to live longer, we want to live forever. So we have better aspiration. Yeah. But this life is not possible to extend it forever. If you have cancer, I tell you I have enough insurance. If I have cancer that can't be really cured, but just extend life, I think I would rather die. It's easier to die. I just say goodbye to my wife. Anyway, I'll be dying slowly, so it's a slow goodbye. I'm just very afraid of pain. What can you do for me, Dr. Tong? Palliative care, okay? Palliative care. Yeah, I don't like pain. Like I don't like discipline. Okay.
Must be a nightmare to the dentist.
Oh! Australian trained dentist is fantastic. Now my dentist for the past 12 years has been an Australian trained dentist, but maybe from Perth, not from this side. I have no pain, no root canal, everything, I have no pain. So I have no fear going to the dentist, my dentist in the hospital. Yeah. The first one was Patrick Wong. Now I've been using this Dr. Yip Chi Kiong. Yeah, the Patrick Wong is now maybe in Auckland or in Christchurch, I'm not sure. He moved to New Zealand. But there's no pain at all. He will just ask me, do you want the anesthetic gel first? Yeah. Sure. I'll put the thing there. And then Even the injection of the anesthesia has no pain, zero pain. If you say you're going to cause me pain, oh, I won't come to you. Not sometimes. Maybe I've forgotten what is pain like in the dental treatment.
You feel a little bit, you can't feel nothing.
Maybe I got full, I got full. Yeah, I just had no pain, So when I introduced my wife to that dentist that's trained in Western Australia, and then she was so happy with him. He's a man. Okay, so liquid biopsy means blood test. Why they do not call it cancer marker or tumor marker? Because it is more specific. Meaning, for medical people, accuracy has two aspects: specific and sensitive, right? So this is more specific. It is also used for following up cancer treatment, actually, but they are hoping to use it for early detection. It's still not perfected yet, or now there are some that are very accurate. Apparently, I forgot the name. Quite recently, there was one that. But it costs the same amount with colonoscopy, the cost. So it's like not much point, It's a blood test that will early detect whether you have colon cancer. But when you have it positive, you're pretty sure it is colon cancer, you still need to go colonoscope. So you might as well do the colonoscope, because the colonoscope, you can do the biopsy, right? You can do the sampling and confirm. Because in the end, for treatment, the surgeon, the oncologist will always want to have a tissue to so-called prove. Sure, it is a kind of caught red-handed that there is cancer cell. Then only, because cancer treatment is very drastic, right? You have side effect, you need a big surgery, or you need to pump in some chemical that is pretty so-called strong, that will cause pretty much quite sure got pretty bad side effect. Yeah, but things have changed. Of course, there are some newer medicine that sometimes doesn't really cause much side effect. So they are called immunologic immunotherapy. Some of us probably have heard of it. So some of these actually may have very little side effects. But in general, the old chemotherapeutic agents are all, it will cause you side effect, pretty drastic side effect. So in the end, you will need to have a tissue biopsy. You need to have some so-called proof that really this is cancer before they will start the treatment, right? So I think liquid biopsy, I'm sure it's available here, is still not very used for early detection. Yeah. Well, the better news is you don't have to get it. Yeah. So what can you do? I tell you the causes. I don't think this is exhaustive. This is not comprehensive. Yeah, but there are many. Inadequate sleep is also an important cause. So please sleep well. Please don't play games in your bedroom, or or look at your social media. When the time get to sleep, turn off your phone. If you can't turn off your phone, crack it, smash it. It will save your life. Or don't say it will save, it can save your life. Okay. Genetics. One of the great Australian, I can't remember the name, but I think Dr. Tong will know, is the one that has tested Helicobacter pylori, right? He actually inoculated Helicobacter pylori. It's a bacteria to his stomach, and that induced ulcer in the stomach or duodenum. Yeah, Helicobacter pylori as a bacteria also cause stomach cancer, right? So it's a biological factor. So there are so many things that can cause cancer. We don't exactly know if microplastic, but quite likely to be causing cancer. Plastic in the sea, fish will eat them. It has appeared in the flesh of the fish. So if you still eat fish, well, you can be eating some microplastic, which can have some endocrine effect. Your organ, affect your organ. And many of our cancer are all hormone-driven. Thyroid, breast, testes, prostate. These are all. There are more and more adrenal cancer too. You know where's adrenal gland? The gland that produces adrenaline. Everybody know adrenaline, adrenaline rush. You know, you need to face emergency, so you will be very alert. So the organ that produces adrenaline is called adrenal gland. It is on top of the kidney. Yeah, there are more people getting this weird cancer, and these are all suspected. So these are all suspected causes. Okay. So it's generally not easy.
Not the chemical and plastics that they doesn't necessarily only cause fish and animal.
Yeah.
It's in fact in agricultural products like food,
Yeah.
vegetables and grains that all
It's everywhere now.
Yes.
Yeah. Satan has put trap everywhere. The only escape clause
You
is
don't have to eat fish or meat to get it. You can eat vegetarian if you get it.
yeah.
Yeah.
Yes. It's possible, but I think the plant source, I think the filter is better than the animal source. The filter, the barrier of things crossing. All right. So okay, I think these are all okay. So there's an organization called World Cancer Research Fund. The headquarters is in London. So they collaborate with the American Institute for Cancer Research. So this is an accepted document. It has been there for probably about 25 to 30 years now. I think the first book that they published on this cancer prevention is in 1996. Yeah. So the 10 recommendation came, and it has not changed. I think it's still in their website. Keep your body as normal, in a normal range. What's normal? For us, it's the weight you were at 21 years old. For young people may be different now, right? But for people of older age, I think you know what is your weight when you are 21 years old. So if your weight around 21 years old is just about within 10% of your current weight, you're good. If you are beyond that, you're too much. If you are 20% above that, you can call yourself obese. Okay? You should not depend on the BMI definition. BMI definition is not customized. You know, human beings are not like compressor machine made by Tim's company. We are not. We are different. Everybody is different, right? How and me, very different. We come from different family, you know. See.
I'm glad you say that, because when I look at the BMI index, it says that I'm malnourished.
Yeah. You do appear so. I do appear to a lot of my patients, except that whenever they point out to me, I say, well, which standard do you use? Yes. Which standard do you use? Yeah. So, yeah. So, what you need to do is to do strength training. Carry the compressor. When you deliver the compressor to your customer, then you gain some muscle and your bone will become heavier. Okay? So, exercise. You don't have to say exercise. I think I explained it. Was it yesterday or the day before? I can't remember. But you need to move your body. You need to move, right? In the five blue zone area, they live an active life. The only place that go to gym and exercise is Loma Linda, because Loma Linda is a more educated area. Okay, so they exercise. So if we live more like the Loma Linda because of our education, our lifestyle, we don't live an agricultural lifestyle in herding sheep and catching fish by the sea, then we better do exercise, okay? Or just help your wife to do housework. That also can do. Dentistry is too little movement. Like me, you know, sitting down there is very too little movement. Many doctors in Penang are already working on standing. Yeah, which I think you still stand, right? No, sit.
Kill your back.
Yeah, kill. That I think dentistry it will be too tough for me. I think the neck, no.
We use stand. We sit still now.
Straight now. Okay. All right. So food and drinks. So energy. Okay, first is I try not to drink my calorie. Okay, so I even unless a person is poor appetite, healthy people, I don't tell them to drink juice even. They should eat. You should try to go as natural as what God designed us to do, right? God gave baby liquid food before they had teeth. We had teeth. God gave us teeth for the purpose of chewing, not sucking. Yeah, right. So you should chew your food. So eat your food. Don't juice it. Okay? Unless you have poor appetite, you need to pump in more. Otherwise, you chew your food. Some design are there, all right? So we believe that we are designed. We are not evolutionary product. So there is a purpose. The teeth is there for us to do something, right? So you should chew your food, right? So that it will help you to avoid excessive eating also. Because if you drink, you still look for food. You still look for something to chew, crackers or something. So all those are you limit, or for me, limit is not good enough. I always eliminate. I just yield not to temptation. Better don't yield not to temptation. I better put away the temptation. Don't keep it in my house, right? So just don't buy it. Every time I go to the shopping mall, not that I'm so holy that I won't like some of the tasty, attractive packaged food, the chips and the corn chips and whatever, or the chocolate. But I always, before I buy, I always think, why should I pay for something to harm my own body? Even though I don't think it's a temple of the Holy Spirit, but I still think I shouldn't harm my own body. Yeah. Why should I pay for something like that? Since I like some healthy food, say like nuts. I like nuts. I'm sure some of you, most of you will like nuts, right? Tastes good. So I might as well spend money on nuts, or on blueberries, or on what, Why go and spend money on chocolate or ice cream? Yeah, I also like ice cream and chocolate, but I like nuts also. So I choose the one that I like and healthy. It makes life easy for me. I don't have struggle. I don't think I'm depriving myself. Because if you think that you are depriving yourself, and how long can you take it? I'm already working so hard. I already live my life so long. I might as well just pamper myself a little bit. So you eat a bit, a bit more. Then you keep some. Then the day I'm frustrated, I'll eat more chocolate. 10 years ago, when I was doing medical administration, where I have to control doctors, that's a stressful job. I used to get home, I used to eat chocolate. I was 4 kg higher than now. Yeah. But after I retired from controlling doctors.
What about dark chocolate? There's this media that says we can eat dark chocolate.
It's healthier than the normal chocolate. Yeah. If you buy for me, I still...
In Melbourne, we have the cherry ripe. It's dark chocolate with coconut.
But I prefer the unhealthy chocolate. Why eat the dark chocolate? It didn't taste that good, isn't it? Does it taste good? Oh, it's bitter. I better eat the lean. It's fantastic. It tastes good, and just eat it less often, rather than eat it so frequently.
Oh, no. In Melbourne, we have the cherry ripe. That's the good one.
Really? Okay. Bring it to me on Sunday. All right. So salt is cancer causing, which is amazing. Some of the things Mrs. White have written it in her time, but it's still not very proven yet. But they are recommending it. Alcohol, animal product, just they tell you to eat as less as you can. They do give you the amount. Less than 1 pound a week. Okay? Less than 1 pound a week for red meat. Yeah. And better totally avoid processed meat. You all know what's processed meat, Yeah. Just avoid processed meat. Yeah. All those hot dog and all this. Yeah. All these things. Bak kwa also lah. Malaysian, no? You know how they make bak kwa? My friend who is non-Adventist and who eat everything, the guy I say 20 years hiking friend, he loves everything, he'll eat everything. He told me how they get the bak kwa is a dry preserved meat. Okay? Huh? It's called jerky here. Okay. So what do they make in Malaysia? I don't know in Australia. I don't think Australia will make it that way. When some of the farm animal will be a little bit ill before they die, they'll quickly slaughter them. If they die, they also will take it. They will just ship it out quickly, and then they'll make it into this. So you can't make it. Huh? It's not allowed. Yeah. But in
the company will be shut down.
yeah, but in Malaysia, well, I think maybe currently it still can be done according to him. Yeah. Okay. Anything else? Eat mostly plant origin. Yeah. That's the last one. Why stop? Okay, so dietary supplement does not help. Breastfeeding is very important. It prevents the kids from being being unhealthy, from being overweight, from getting some cancer. When you're overweight, you're more likely to get cancer, and it does prevent the breastfeeding mom from getting cancer too. Why? It is because of estrogen, right? When you are breastfeeding, your estrogen is very low. Exposure to estrogen, extra estrogen, increase cancer risk. Okay, yeah. So that's why more pregnancy prevent, more lactating prevent. Yeah. Thinner also prevent.
But there's a paradox. Estrogen prevents heart disease for women.
That's not true. That's not true. That's not true anymore. HRT is not recommended anymore.
No, I mean for heart disease, reduce the risk.
Yeah, HRT.
No,
No,
not
estrogen help women to have better HDL. Okay, yeah. That indirectly protect women from getting heart disease. It helps women to have a healthier blood vessel, lower blood pressure and all these things. Yeah.
But it causes breast cancer.
It might be excessive. So even men, when you have excessive fat, you have more estrogen. But I think also actually the environment, many things have estrogen effect. Many chemicals have estrogen. We know some of the pesticide has estrogen effect. Probably some of those complex molecule, dioxin and all these things, they also have estrogen effect. Because probably the molecule actually also act on the estrogen receptor and stimulate the estrogen receptor. So all this actually increase. You find that the estrogen over manifestation estrogen in the society is very, very common. For the women, many people will have, many women will have fibroid. Okay, fibroid. Uterine fibroid. Yeah, and endometriosis is also very common. It's not just breast cancer. Yeah, it's an over expression of estrogen effect, which is so. They are even talking about telling young girls who at the age of 20 plus actually to be on oral contraceptive pill to prevent endometriosis. Because endometriosis is very troubling. It causes infertility. It causes a lot of menstrual pain. And some of them, they will actually even go into depression because the pain, the uterus pain can be the whole month. Can be the whole month, right? But it becomes so common. We don't exactly know what is the prevalence. But I know, as far as fibroid is concerned, my client itself they are 30%, and I look at the statistics in US, it's 70%. Yeah, it's 70%. It's okay. I think it's almost last. The 10 already. 10 already.
But that one,
Yeah.
Dr. Ng,
Yes.
the soybean and things like that, they have
They have
similar.
they have phytoestrogen.
Yeah, so it has a similar effect to estrogen.
It's some. Well, I think there's a is
So with breast cancer, with
is
breast
argument is there are some it's not easy to explain, but we are very sure. Okay, this is Gary Fraser answer. Huh? We are very sure soy is protective against breast cancer among Asian. Sorry for the Caucasian. Huh? They couldn't prove it in the Caucasian, but it's definite for Asian. Right? It reduces breast cancer risk. It reduces breast cancer recurrence too. That means a breast cancer survivor also is good for them. But unfortunately, they couldn't prove it in the Caucasian. Right?
because we don't drink in Asian society in China, they never drink milk at all.
Right. Yeah. Basically, they look at the big epidemiological study, big population study. Japan, China, the incidence of breast cancer is a lot lower. Prostate cancer is a lot lower. Yeah, it's a lot lower. And then when these people move to America, and it will change. Okay, first generation, second generation, it will just go dose related. Okay, so it is very well. In public health, this is so-called proof, but I think a lot of clinical medicine, they would want to see it, see the intervention, but which is not possible in this kind of study. So for us, it is considered proof. If you look at a China study by T. Colin Campbell, you will see all this, that it is a proof. Adventist health study actually helped the scientific world to see, because there are a lot of doubt. A lot of doctors will advise ladies not to take soy product. But to us, Adventists, is wrong. It is wrong. It is sure protective. And logically, God has revealed to us Adventists. That's why Adventist health should not just based on science. I have not shared, I actually have a slide, Adventist health philosophy for Penang Adventist Hospital, is that Adventist health philosophy is based on inspiration and science. Okay? If science and inspiration clash, inspiration trumps science. Okay? Yeah. Because obviously we must go to the designer to ask for the answer rather than just, and science, scientific method is a good method, but now scientific method has been skewed. We need to learn how to read and how to tease out this guy, the design of their research, and the selection and the exclusion criteria, which is,
And who pay the bills?
it is so complex.
No, who pay the bills?
Yes, the conflict of interest, they people, you can find clinical study that say beef is good.
That's the reason.
And glucoline is good, glucose powder is good.
That's the reason why in Australia, they always say milk corporations, everybody should drink milk to increase their calcium.
Yeah. Yeah.
boost.
That's
And-
right.
And who did the study?
Yes.
The milk.
Yeah,
industry.
they support. They do not do it, but they support they give grant to the university. So in the end, whatever that show that it is not good, before they conclude the study, they kill it. So the negative study, those research that have been kicked out, you can't find in the journal. So you are not able to read the whole big picture. That's why we need inspiration. If you read enough of spirit of prophecy, we have to have confidence in spirit of prophecy, and then life will become easier. You don't have the confusion. We have the clear direction. We have the sure word of prophecy. follow. So I'm not confused, and I will tell my patient that if the day you see me have problem, then you can tell God for me that his program is wrong or serial prophecy is wrong. Right? Okay, so this is my last slide, how to change. Let me give you an example. Okay, so this is, to make changes is not easy. We don't like change. As I was telling my patient, most of my patients find it difficult to change. Yeah, it's not easy to change. So I gave them a 2x2. Let me see, did I draw it here? I draw it here. Okay, so I show people to do it a 2x2. Actually, it's 2x2, but because here, what you like and what you dislike and what is healthy, what is unhealthy, right? You can define it as scientifically correct one, or you just based on your whatever knowledge you have. So, what you like and what is healthy, just eat more. No problem. It's going to make you healthier, right? So it's easier. What you like and unhealthy, well, when you are not having health problem, don't torture yourself. You can reduce. You can decide how much you want to reduce. If you are still pretty healthy, you want to just reduce 10%, it's okay. But don't be too gung-ho until you want to cut off. You say, I'll never eat again. I think a lot of time people will not do it. After 3 months to 6 months, they will rebound. So since this is not kind of emergency, I rather tell you to have a gradual change. Okay, you reduce 50%, is very good. Then in the place where you don't like, yet is healthy, I tell people, don't force yourself to eat so much. Because if you suddenly force yourself, then you will remember Dicky's face and you hate me, you won't invite me again. Even though, some of you may like me to come again, but you hate me, right? You don't like broccoli or don't like Brussels sprout, like. Okay, so then you remember my face. So, but I divide this into two groups, what you hate and what you don't mind. So what you don't mind, you can go slow and increase gradually because you do not want to keep cutting this and then you will find that your choices of food become less and less, narrower and narrower, and then you think, my life is getting finished. It's getting boring, my diet is getting boring. Right? So you need to gradually widen these choices. So as I've been telling my patient, I can tell you one thing I didn't really like that I think is quite healthy, at least to the Chinese. Ginger. I dislike ginger. I really dislike ginger. I'm not sure how many of you like ginger. Oh, most of you like ginger. So tomorrow you will put a lot of ginger. I think my mom spoiled me, and my wife also spoiled me. Because I didn't like ginger, she will make sure I don't mind the smell and the taste, but I mind biting it. So she'll cut it very big so that it's easy for me to pick it up, right? Yeah, it's easy. If you cut it very small, you slice it until very small, it's very hard to pick out everything, then it's troublesome. So, but I decided maybe about 6 months ago, I decided, I've been preaching to my patient to change. Why don't I just try it myself, right? You don't just preach, you better walk the talk. So I started, every time I would take it like taking pills, tablet, just one. Put it in the mouth, chew, very fast, and swallow it. Like swallowing poison, right? Well, but it's true, after some months, you become not so, it's not so unpleasant, right? It's gradual. You get this acclimatization. You get used to it. Okay, so this is what I do. Of course, we all know that unhealthy and dislike is no issue. Right, so this is my last slide. Cancer in general are curable. Cancer mostly can be avoided. And we can adjust our lifestyle we are able to adjust with God's help. Sorry, I still have Bible verse. It's not easy to do the right thing, but God can help us. Christ can help us. Right.